So welcome to this session. We're delighted you can join us in celebrating the accomplishments of our students. At DePaul, we try to include students so that they're not just kind of passively receiving knowledge, but helping to create knowledge as well. And so the students are encouraged to do research projects like this one. We have this session as a way of kind of providing some feedback from scholars from around the world. So I'm Bill Cavanaugh. I'm the director of the Center for World Catholicism and Intercultural Theology at DePaul. It's a research center on the Catholic Church in the Global South. Karen Kraft, Marlon Aguilar are the staff people at the center. Stan Chuilo, Mike Buddy, the other faculty, and Elijah Gray, Finnegan Chu are our student workers. The World Catholicism Week is something that we began 10 years ago. Used to be a week, now it's a weekend, so that more people can attend. The topic this year is, it was actually decided on before the pandemic hit. We were going to do this topic last year, and we had to cancel the conference altogether. But it's obviously quite relevant, the Catholic Church and healthcare around the world, the Catholic Church being one of the largest healthcare providers in the world. And so as this conference goes on, we'll be talking about themes like the gap between the rich and the poor, North-South partnerships, the relationship between Western and non-Western medicine, biblical narratives of healing, and so on. So the poster session usually takes place where, in person, of course, where the students stand by their posters and people come and visit and discuss their posters with them, and then we give them feedback. And then we all have dinner together afterwards, which is usually wonderful. So have a nice dinner tonight, but unfortunately, all of the feasting is going to be virtual and feasting for the minds. So what we're going to do today then is I will introduce our distinguished panelists, and then the panelists will discuss the projects of each of the students. 5 minutes is going to have to be the absolute maximum. We're going to have to be strict on that because we need to finish by 9:30. But if you have questions, we can, I think, maybe concentrate more on the students that are here rather than the students that are not. And we'll begin with them, and hopefully more will join us as we go along. So our panelists, Dr. Sam Orach, from the Uganda Catholic Medical Bureau, one of the leading lights of Catholic medicine in Africa. The Uganda Catholic Medical Bureau, a large organization, 296 health facilities, and Dr. Orach is in charge of the whole operation, the executive secretary. He's well known both nationally and internationally, has been on a number of governing advisory boards within Uganda, and is also on the board of the Fetzer Institute in the United States, has been a fellow at Emory University in Atlanta. And so we're delighted to have you with us today, Sam. Alex Martins from Marquette University in the Department of Theology and the College of Nursing. He's a theologian and a bioethicist from Brazil, Minas Gerais. Got his doctorate at Marquette, and also has had various positions elsewhere. Has a postdoctoral degree from the Human Rights Center at the University of Coimbra Law School in Portugal, and is the author of The Cry of the Poor, Liberation, Ethics, and Justice in Healthcare, a tremendous book that just came out in 2019. So welcome, Alex. And Kochurani Abraham, the regional coordinator of the Indian Christian Women's Movement for Kerala, and also the vice president of the Indian Theological Association, has a PhD in feminist theology from the University of Madras in India, and has been both a scholar and a social activist within India, and is part of some much larger networks of theologians in Asia and around the world. Her latest publication is Persisting Patriarchy, Intersectionalities, Negotiations, and Subversions, published also in 2019. So welcome, Kochurani. We're delighted to have you here with us as well. So we had an order determined, but I think we're going to mess with that order a little bit and start with the students that are here. So Stephanie Gomez is here. Alex, if you would like to give feedback to Stephanie, we'll start there.
It sounds good, Bill. Thank you for the wonderful welcome, and thank you for having me. It's an honor to be here. It was a great pleasure to read all of your posters and watch your videos, not only the three students I was in charge to give a feedback, but all of you, all the students, I had the opportunity to watch all. So it's like, congratulations, it's a great work. I feel very happy you had that opportunity. I wish when I had your age, I had the same opportunity. I didn't have, and I think it's great. And thanks to Paul and the Center for the World Catholicism for promoting that. Stephanie, I have opportunity to go a little more like carefully in your poster and watch your video from finding the balance between Christian faith and Latin American folk healing. My feedback for you, you'll be, I'll talk a little bit your method, how you used to do your analysis, your key points, and then some suggestions. And I have a question for you, just for you to reflect. And maybe I don't know if you have time, you can say so, answer that. But if not, for your own reflection and further development, if you want to continue that. So first of all, in terms of method, you do, if I understood correctly, more like a historical understanding of curanderismo in the Catholic Church, especially in North America, like Mexico, US, that region, especially when you go back in the time, was not very clear what the division today. Part of what is today South US, South California was Mexico, and those. So, and you did a great job in do that historical presentation, even included, and that is remarkable, for include a primary source. You include a text of the Jesuit missionaries, that it's a primary source, that it's the text is Floregio Medicinal. So it's remarkable. Go to the primary sources. It's always essential. Make your work stronger. You're not reading and analyze only what people are talking about primary sources. You're reading that, but you're also going to the primary sources, and that it's remarkable in your like historical presentation. So when you present about the El Niño Fidencio, as you're doing that historical, I would suggest you you put that present in time. Like as I never heard about El Niño Fidencio, and I was when which century, which decade that person lived. So you didn't mention that. You make very clear in the others figures you present in your papers. I would like, then I had to Google a little bit trying to figure out. He lived in the 1898 until 1938. So that period, like in the end of 18, the beginning of 19 and 20, 19 and 20th century. That's an element of your method. I think it's seems very historical, like historical theology, trying to understand, go to the primary sources. That is remarkable. In terms of your findings, analyzing that, you are very good to show the tension that existed between the I would say official church, the authorities, the bishops, or the Europeans, missionaries, in that experience of faith that people are living in, that experience that is very what you call in syncretism, that mix between the traditions they have with the traditions they learn and came from the Christian missionaries from Hispanic. And you show that's a fine you present, and it's a very well that conflict, and even that conflict that is related to racial conflict, in which the missionaries and even the Anglo American Christians in the conflict with Latin American Christians, in which the Anglo or the missionaries think those mixing of experience of faith and healing, it's inferior that what they have, they thought maybe it's superior to not have that mixing. What if you go deeply to understand, there's a huge debate in the church. What is the pure faith? Every faith is mixing. Even when you think about Jesus, the experience of the first community, then move to the Roman Empire, and then you incorporate a lot of elements of Latin culture, Hellenistic culture to shape what is Catholicism or Roman Catholicism today. So, it's very interesting that's something if you want to develop your research, trying to, so elements always has a cultural exchange or enculturation and you show that conflict. And the last thing in your findings is about that practice of curanderism and how that's meaningful for those Latin communities. I have to tell you, from my own experience, my grandfather from my mom's side was a curandero in Brazil. And I remember when I was a child, when I have some child disease like fever or something, my mom take to my grandfather to give me a blessing, or to even give a blessing with a little. I remember in Brazil with a little special kind of a plant they use like to do that blessing to you, and then you feel good, at least spiritual and stronger, to continue your search for actually healing physically. And you show those elements, how that's meaningful for the community. You should not simply dismiss that, but you should to find, as you want to say, a balance, a healthy balance. And a good element that I conclude is the element of the holistic vision. That's a kind of criticism of Western medicine today, to fragment it a lot, the human body, especially to trying to find healing, and sometimes forget to see the human body, the human being, as a full holistic person. And then that that perspective you present show that have that criticism is worthy to take. So thank you for the opportunity to read. And my question for you is, just for you to reflect on, is what is, or how you find for our time today, a balance, like in a practical, between curanderismo, modern medicine, and Catholic faith? Do you think those practices, curanderismo, has something to offer to the Catholic faith and to the way modern medicine is? So thank you.
Thank you for those kind words. Should I be trying to tackle your question right now, or?
If you have some initial thoughts, I am aware of the time here, but if you have some initial thoughts, go ahead, Stephanie.
I would say that the balance is definitely to be, I believe, desired, especially since there are healing elements that Catholics do generally lean towards, especially in Latin American communities. I know like there's like the Catholic Church uses exercise salt, they use holy water and oil. So I don't see why there's such a tough division between curanderismo, Latin American folk healing, and like Western medicine, because it's just looking for comfort both spiritually and mentally. And I think just finding that balance is like would be beneficial to many Christians, I believe.
Awesome. Thank you, Stephanie, and thank you, Alex. Very interesting. I said I was going to be strict on the timekeeping, and I was not.
Sorry.
But since we have just 4 students with us, I think we're going to kind of go ahead and use up the time with the 4 students that we have with us. So, but do try to be aware of the time. We do need to wrap up by 9:30. Let's move to Kochurani, and you will be responding to Olivia. So take it away, Kochurani.
Thank you very much. I too feel very good to be connected to DePaul and to all of you. And it was a very enriching experience to go through the posters of the students. Unfortunately, I didn't get time to go through all, but I found very interesting the 3 that I've had. And Olivia, very happy to respond to your poster and your presentation. You know, what I found very interesting is that you underline the significance of bringing into conversation 2 aspects that are apparently disconnected in everyday living. That is the question of health and theology. Even though Ryan is not here, I found this connecting with Ryan's presentation also, because he was doing on, not Ryan, sorry, it was Sarah, on evangelic, okay, the whole thing of critique of modern medicine. And here you are bringing into conversation liberation theology with partners in health, which I found extremely interesting. And one aspect which I liked very much was identifying healthcare as a human rights issue. And this, I felt, invites us to pay attention to the socioeconomic and cultural configuration of any given society in diagnosing a disease and taking the right remedial measures for restoring the health of individuals and of communities. It is in this context that Dr. Farmer's contribution to the healthcare of the marginalized and the founding of Partners in Health in order to accomplish this mission becomes very significant. And you have illustrated this by giving the case of PIH's intervention in Haiti. So I really appreciate your linking of healthcare with liberation theology. And I suppose in doing that, you are seeing that sickness is not something that affects just an individual's body, but has deeper structural implications. Because I am not, I'm not read enough on Dr. Farmer or, Partners in Health. From the little I could gather here, I suppose they are mainly looking at physical health, the physical well-being, sickness. But liberation theology is a lot more broader. I belong to an organization called World Forum of Theology and Liberation. And that has started parallelly with the World Social Forum in 2002 in Brazil. Now it has become international. And there we are looking at theologies of liberation, not just liberation theology, which started in the Latin American context, because we really felt we have to keep this alive, theologies of liberation. So what I would like to invite you to explore a little more, because this, I'm sure it's a very minor research project that you're doing as an undergraduate student. But certainly if you are interested, you are looking at the structural concerns of health, or the multifaceted problematic of health in relation to society. Like I'm from India. In India, we cannot look at health purely from a physical point of view. We can look at it connecting the physical also with the economic. This I'm very sure just brought out here. But we have to look at health from the social point of view, from the gender point of view, because a lot of women and those who are, those who belong to the gender non-conforming groups suffer a lot of violence in different forms, which affect their well-being, which affect their mental health, which affect their emotional health. So this conversation between liberation theology, you have taken very well, Gustavo Gutierrez, and the invitation to turn to the poor in order to build a just and healthy society, which you have also highlighted in your conclusion. What I like to invite you is to broaden the concept of health, which I'm sure you are doing as part of DePaul's engagement with health, and also broaden the concept of theologies of liberation beyond the Latin American context, or even what has been triggered by the South American initial understanding of liberation theology, which has been very beautiful, powerful, liberative. But now, like for example, feminist theology emerged within the broader umbrella of liberation theologies, but women felt their concerns as the oppressed group were not taken into consideration by liberation theology per se. No? So I think broadening the scope of health and broadening the scope of liberation theology, as you young people engage more with this, would be very enriching, not just for you personally as scholars, when you emerge as scholars in different fields, but also for, as Bill rightly brought out, in creating knowledge that is liberated. So I would like to conclude with one question. In the light of your study of partners in health in relation to liberation theology, what do you think are some of the steps that the Catholic Church needs to undertake in order to build healthy societies and healthy nations? Thank you.
Thank you for such the kind words. And to answer your question, which I think is a great question, is I think that the church should be a little bit more less influenced by cultural factors that go ahead and make accidents within the whole liberation theology and the purpose of spirituality, which is to provide purpose and to provide reasoning for one's faith. So I do believe that allowing and accepting to reflect on one's conscious awareness of self is definitely something that the church should be more accepting of, just because there are different beliefs that don't really align with the values, and that could be a form of subculture influence, which is completely understandable. And I think Partners in Health, it does a really great job helping intersectionalities really find who they are and give them the faith in humanity, because Partners in Health is an organization that accompanies the poor throughout their whole entire struggle, which seems endless within people living in third world countries that don't necessarily have access or availability to the modern medicines that we have and we exploit in very developed countries like the United States, which is very unfortunate. But as we're all living together in one world, one globe, I think it's important that we all share and give the resources to not just those who have it, but those who are in need of it. So thank you so much for evaluating and providing your feedback on my research. I really appreciate it.
Great, thank you, Olivia. Thank you, Kochurani. So we have two more students here, both of whom have slightly more daunting prospects here, because Jonathan Galante did his project on Alex Martin's work, and Alex will be responding to him. And Tyler did his work on the Uganda Catholic Medical Bureau, and the executive director of the Uganda Catholic Medical Bureau will be responding to Tyler. So a unique opportunity for both students to learn a little bit more about these projects. Sam, why don't you go ahead and respond to Tyler?
Thank you very much. I must first start with a disclaimer that although I have worked for the Catholic Church for 35 years at various levels, I'm not a theologian. I have not done philosophy. I'm purely a Catholic doctor. So my outlook and feedback will be from that perspective. Tyler, first of all, I was very excited to see that you took interest in looking at the Uganda Catholic Medical Bureau, which by analogy is like the National Health Department, say, for the Catholic Church. So if you compare that to government, this would be the National Health Department, maybe in the United States, but this is for the church. And I found it very exciting that you tried to look at this. Now, I realized that there was quite a lot that you didn't have opportunity to get in terms of information on the UCMB, which is a short form for Uganda Catholic Medical Bureau. And I only wish you had made maybe some search or got in touch with us. If that was allowed by the university, we would have given you even a lot more information. As I was looking at your poster and also listening to you on the video, I had to restrain myself because I have been working in this system for so many years that there's so much I know about it that my expectation could easily go through the roof. So I had to restrain myself and say, no, I think at his level, I will want to be very soft and not demand too much. So I'm not going to give you a little bit, much beating over this, but something just maybe just to help you to go through. And for that, I want to say that the Catholic Church started its services back in 1899 with the first health facility. And over the years, the Catholic Church has opened about 310 health facilities, although at the moment, there are 296 that are accredited to the health department. So if you want to show that history, you can do so. The health department itself was started in 1934. So it has been around for many years, and it has contributed quite significantly to health services in this country. Looking at your research, I realized that you picked mainly information about HIV. Kamosha Christian Caring Center, which is basically doing HIV and AIDS work with a little bit of general health service, but largely HIV/AIDS. And you also picked a little bit of what UCMB does in HIV, the mentorship program that's doing. But it's a lot more that UCMB does. For example, you mentioned the huge funding we're getting from the US government You mentioned USAID, but we have got even a lot more money from CDC, all for HIV. And but there's a lot more beyond that. Even at the national level, we do a lot in terms of strengthening health systems. When I talk of health systems, I'm talking of the 6 building blocks of health systems of the WHO. So you may want to read about the WHO's 6 building blocks of health systems, about leadership, governance, and management. That's one block. The human resources for health, health financing, health informatics and information, the medicines and other technologies, and then the design, the structure of service delivery itself. So we work to strengthen this in our network so that they are able to deliver on their mandates. The health facilities are able to deliver on their mandates because they are having a strong system. And we have contributed a lot in terms of strengthening the health system of the Uganda health sector. Just beyond HIV is quite a lot. And that's why for many years I have been a member of the Health Policy Advisory Committee of the Ministry of Health because of the contribution that, that we make. So tomorrow, if you listen to my presentation tomorrow, or you may even want to listen to it already because it is on Google, or if you want to read the article I've written, you will probably see a very summarized summary, if I may call it, of the output, the performance of the network. Because in the end, the work we do as the national office translates into service through the health facilities. And if we don't coordinate them well, if we don't have good policies for them, if we don't do good linkages, good advocacy, good guidance, good strengthening of their systems, they will not be able to deliver on their mandate to the people who go to them for services. So we look at the performance of our health facilities reflecting on what we do as a national office. So if you want, you can look at that. And in our past reports, which are on the website, you can find also a lot more about that. You talked a little bit about Kamosha Christian Caring Center, which is one of our flagship HIV services, service points that started in 1987. But I think there was some factual error about it. I think you presented it as something for East Africa. It might have been, and I think it was, the only one of its kind at that time, not only in Uganda, the whole of East Africa, but also in Africa when it was started. But it is in Uganda. It serves basically people within Uganda. It is within the capital city. It was started by a nun who was a medical doctor, Dr. Miriam Duggan, who started it. I think I will be very ready if that opportunity is still there from the university, if the opportunity is still there to improve on your thesis, if the opportunity is there, any data that you think you may be useful for you, I'm ready to give you anything that you think will help to improve on your data. When I was reading your poster, I think there was something that you mentioned. You said about, I think reflecting on what Jesus would want us to do. And for me, it is a question that cuts across, not only to you, but to all. If I was looking at the paper of Molly Chambers, who seems not to be here, I would have asked the same question. What is Catholic about Catholic health services? I think we need to reflect on that. What is the Catholic identity of Catholic health services? and we may talk about the work culture, you may talk about the holistic nature of the care. And for example, in Uganda, we are the only ones who have been training people in clinical pastoral care. And with that training, we have found that that training has a lot of impact, not only on patients, but even on the health workers. You know, the health workers who have been trained in clinical pastoral care, because then they are integrated. They are pastoral caregivers as well, being health workers. And the common question I ask myself is, what would Jesus ask? What would Jesus want me to do if he was physically here at this point? How would Jesus want me to carry out my services? When I was still a very active practicing medical doctor, even when I was, at the operating table, I would ask myself, how would Jesus want me to carry out this surgery? So I think that's something that the Catholic identity of the services is something which is very unique, and we try to portray it in our work. We also try to stress the need for strong family social linkages. We don't just treat the disease. If tomorrow I see that David Toole will be talking, and I remember one time on their website of Duke University, they quoted me saying, I was not trained to treat a disease. I was trained to treat a person. And that's what we try to emphasize quite a lot as UCMB. And, it's a contribution that probably is very hard to measure, but it reflects on the outcome, of the people we treat, and their desire to come back to these same facilities. Many times when people have gone out, we do joint review of the health sector with the Minister of Health, the donors or other partners. And when they go and come back, they say, we went to these facilities. This one belongs to UCMB, belongs to the Catholic Church. This is what we found. This is what people said. But people don't know where that's coming from. It's coming from the strong system we have established, but also from the culture of work and the nature of people that we try to bring up, to try to demonstrate their faith in the service. So to summarize, I go back to the question of, do you first of all have an opportunity still to improve on your paper? If so, what information would you want from us to try to improve on that paper? Thank you.
Thank you, Sam. Let me just jump in here. We've just got about 9 minutes left. If I could answer the first part of that question for Tyler, this was just a short project in a short 10-week course. And so the project is done. But Tyler, you're certainly welcome to get in touch with Sam if you want to pursue this any further. So thank you both to Sam and Tyler. So again, I'm aware of the time. We just have about 9 minutes left. Alex, if you would respond to Jonathan's project on your work.
Well, thank you, Bill, and thank you, Jonathan, for take time to read my book and some of my publications. My feedback, I'm trying to be short, because even short, and especially because I'm biased to judge my own work. So as I did for Stephanie, I just say one word about the method that I could see in your paper, in your poster, and then some findings, then a question for you to reflect. You don't have actually to address the question today to me. And then if you want to keep in touch with me, please reach me. I'll be very happy to talk to you. I had a professor when I was a student in college like you. He said, when we study the author, it's good to study the author that is already dead, that's someone that's still alive, because there is many things to come when people are still writing those kind of things. But you are brave to trying to present, like trying to understand the thought of an author that's still I would say like a young in his early career path, and have a lot of things to, hopefully I have a lot of things to write in my life yet. But so that's, I praise you for that courage to do this. And second, in terms of method, different than Stephanie did like more historical, critical understanding, analysis of curanderismo, you did like more a text analysis. So you focus on 4 texts, like the major text is the book, and 4 articles to try to understand the critique that the author provide to healthcare systems, basically. And you mentioned that his understanding of the America and Brazilian system, but particularly the Brazilian system, and see how the contribution of theology, especially liberation theology, present to that. You understand quite well the use of, you mentioned that, theological tools to address the reality of healthcare. And those theological tools are concepts like the structural sin, the preferential option for the poor, engaging with the poor in dialogue, and listen to them and to their story. And then the church be kind of like a way that can listen to the stories and tell those stories to the world of healthcare. So that's the key elements you find in your analysis, trying to understand those two helps to, we reveal what it's called structural violence, and the structural violence in the context of healthcare. And of course, you present like those theological tools come from Catholic social tradition, but you also highlight the dialogue that the author have with Protestant Christian ethics as well. They provide like show and have the structural violence. Structural violence is kind of anti-ethics. What the ethics is, ethics that you train to understand and dismantle that violence to promote the life of the most vulnerable, in which we do that. We do theological tools from the ground and dialogue with the stories in the poor from that. Yeah, I think understood that very, very well, and I appreciate to read, and thank you a lot for doing that work. In your post, I just want to highlight in one thing, you put a picture of you serving a sick person. I like that. It's just because it's matched a lot with the author idea to talk about from real experience, and then at least for me show your real contact with that reality, that you're not only a theoretical analysis, but it's part of what you are to serve those people in need. I think that picture tell me that message. I hope I understood correct. And the thing is, I mentioned, you didn't address it, but in the book have preferential options for the poor. It's not simply a concept, but like a commitment. It's like it's very connected to the poor farmer. It's not simple, oh, I want to help the poor. No, I'm committed with a life that reflect the life of the poor in terms of some kind of austerity, simplicity, and work with them, not simply for them. I think that's great. Thank you. Great work. As the other work I read to Stephanie and the other student is not here, also was very, very great. Thank you, Bill, a lot for that opportunity. I appreciate. And some question, Jonathan, for you to reflect. And again, you can contact me. You can keep talking with that if you have more interest. You mentioned in the final of your paper, a Brazilian experience called Pastoral da Saúde. It's a kind of a grassroots movement in healthcare, very different than the United States have like a lot of institutional Catholic action in healthcare, but because Catholic hospitals, Brazil is more grassroots movement from the Pastoral da Saúde. And my question is, do you see a room for that kind of Catholic health ministry from the ground, in the grassroots, in the United States, and not only those institutional hospital perspective? So thank you again, and good job.
Thank you, Alex. I'd like to respond a little bit about Pastoral da Saúde in Brazil and see if we can implement something like that in the United States. I think that anywhere that structural violence exists, especially in developed countries, where healthcare has to work alongside with a capitalistic system, and the focus from quality healthcare gets shifted to how do we save money here or there. That a grassroots movement has to take place, especially if you're going to operate in the spirit of the preferential option for the poor, because at that point, making money isn't the central focus. It's how do we get high quality healthcare to those who are marginalized. And in any system where it precludes that from happening, a grassroots movement must take place. Yeah, Alex, I'm going to stay in contact with you, and thank you for your kind words and your reflection on my poster. Appreciate it.
Thank you. Great job.
Awesome. Thank you, Alex and Jonathan. Tyler, I want to come back to you. I'm sorry I cut you off. Would you like to respond to Sam or say anything, anything at all?
Yeah, sure. I can respond, shortly. Yeah, as for the question of what other information, what I request, it was very hard, when I was doing my research to find, specific, sources in DePaul's, search engine for, scholarly, sources on the UCMB. So I had to, diversify my sources a little bit, but I would have, if I knew I could get in contact with you and had your information, I probably would have asked some more information about some of the broader, services that the UCMB offers besides just, the Kamwila Christian Caring Community. That's the only source I was able to find in our system. But other, sources of other, medical facilities that provide different, services to the people of Uganda besides just HIV and AIDS. And also, I like how you mentioned how, when you were practicing your medicine, ask more questions because we couldn't find much about how the UCMB and the Catholic aspect of healthcare, affects you and, people at the UCMB and their daily care of people. So.
Awesome. Great. Thank you, Tyler. So we have come to the end here. Sometimes God works in mysterious ways, and sometimes God even works through technical glitches. Today, God was working. Only 4 of the students were able to log in, but that allowed us a little bit more time, a little bit more leisure. It would have been very hard to stick to the 5 minutes apiece rubric. So I'm glad we had a little bit more time to discuss this morning. There's a question in the chat, and it comes from a distinguished audience member who is a doctor of nursing practice at the University of Virginia School of Medicine, Kim Alborough, and she is simply asking the students here, do you have any plans for nursing medical graduate school? And I'm sure she would love it if you got in touch with her, or if you had any interest in that field. Any responses to that question?
I'll respond to that question. I'm definitely interested in the healthcare field, although I would like to pursue a career in healthcare communications. I think that's a little bit more of my strong suit. I enjoy writing, I enjoy reading. I'm not really good with my hands, and I wouldn't trust myself with anything and having to care for someone's life, but I can try my best, and that's with writing and reading.
Awesome.
I'd like to respond to.
Yeah, please.
Yeah, I was a medical laboratory technician in the Navy for 7 years, and I decided that wasn't it for me. Like, I needed to go further. So my plans and dreams are either to become a physician or to work in the public healthcare sector as an epidemiologist. So yeah, very interested.
Awesome. Well, as you can see, Kim Alborough has put, she says she's a Navy nurse too, and she has put her email address in the chat. So if anybody wants to get in touch with her directly, that is awesome. Great. We're past time here. Thank you again so much to our distinguished respondents from 3 different parts of the world who have given us your insights on Catholic healthcare in many different environments. And thanks especially to the students for the hard work that you put in and being willing to put yourself out there and and take feedback and questions from our distinguished guests. So thank you all so much, and please do tune in to the rest of the conference. Hopefully that will go smoothly from a technical point of view, more smoothly than this morning anyway. Great, thank you everybody. We'll see you soon.
Thank you all, and a round of applause for the students. Great job.